Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. Jay Warren.
All right, hello, and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I am the Family Wellness Chiropractor and the Wellness Care Coordinator here at the CAP Wellness Center. And today we have Dr. Pia Martin back with us. We've brought her back by popular demand to the podcast because her first episode, The Essentials of Prenatal Nutrition, is one of the favorites of our listeners. And if you are one of the few people that have not downloaded that episode already, please go to iTunes and get that episode. And today she is back to talk with us about gestational diabetes. She's going to explain all the blood glucose screening tests, what they mean, what the ramifications are for you and your baby during pregnancy, and most importantly, what you can do, either one, if you have gotten a diagnosis with gestational diabetes, but even more importantly, how you can prevent it and all the healthy things you can do throughout your pregnancy for you and your baby. But before I bring Dr. Pia back here, I want to take a moment, as always, to thank our sponsor, the CAP Wellness Center. The CAP Wellness Center in Encinitas, California, has assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal and postpartum wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And now, let me introduce to you once again Dr. Pia Martin. Dr. Pia is a practicing wellness doctor in San Diego, California. She is a graduate of the Parker University in Dallas with a doctorate in chiropractic and certifications in clinical nutrition and wellness coaching. She is also an active member of the ICPA and author of hundreds of blog posts on healthy living. She specializes in providing custom nutritional health programs for new moms so that they can have a healthy pregnancy and a healthy, happy baby. All right, and with no further ado, I'd like to welcome back to the podcast Dr. Pia Martin. Dr. Pia, hi.
Hi, Jay. How are you?
I'm doing great today. How are you doing?
Good, thank you, and thanks so much for inviting me back.
Oh, it's a pleasure to have you back. You know, it was something that your podcast, the original one that we did, I believe it was podcast 005 on prenatal nutrition, was a very important subject, and I was checking the numbers this morning. It's the number one most downloaded episode of our entire podcast. So congratulations on that, and thank you.
Thank you. I'm thrilled.
Yeah, well, and so for those of you listening, if you haven't listened to that episode, definitely go back and listen to it. It's amazing information. And for those of you who already have listened to it, you'll know Dr. Pia is going to share great information again with us today. So what our topic is today is glucose screening and tolerance tests for pregnant moms and how to avoid gestational diabetes. And Dr. Pia, I know this is a subject that you are very passionate about and you've worked a lot with. And I know that you've devoted an entire chapter in your new book to this topic. So can we start off first by you just sharing why you think this topic is so important and what's going on with it?
Well, Jay, I am really passionate about this because this has an impact not only to moms going through pregnancy and the birth process, but also it has an impact down the road to the unborn child and then born child. So I'm really passionate about it because I'm seeing more and more moms that are having issues with blood sugar during their pregnancy. And they're also having challenges trying to find and group information together that straightforward makes sense and provides the support and the solutions. Oftentimes when they fail a glucose screening test, which is the first line of defense, or they fail the following test and have a diagnosis of gestational diabetes, a lot of the times they get really frightened and worried. They're caught between their OB, an endocrinologist, a nutritionist, and they start to panic a little bit. And stress is really not a good thing for keeping one's blood sugar in a good stable number.
Right.
And they often start feeling like some blame. They blame themselves. I could have done, should have, And so what we want to do is we want them to understand that getting this diagnosis is not a good thing, but it's not something they can't do something about and feel supported with, and then move forward postpartum. And just, this could be a really, in some ways, a nice little gift, although it doesn't look like that on the surface. So we want to also address that. It's not the end of the world. There are things that they can do. So with that being said, if you do have a diagnosis of gestational diabetes, it kind of means that your blood sugar levels are too high. And it's serious. And moms need to take it seriously. So this is kind of like the check engine light. If you have it, there is a huge likelihood that you'll end up with type 2 diabetes down the road later in life. So there's a strong possibility. And there's also a strong possibility that if this happens during your first pregnancy, there's a good chance, very high chance, it will happen with pregnancy number 2. So also moms that have gestational diabetes often have big babies, and they're at high risk of having obese kids as well, and with the problems that could bring down the road. But there are options that you can support you medically and naturally, and you also need to include your birth team in your plan. What you decide to do postpartum is super, super important. Often this is an area that's not discussed, and it's probably one of the most important aspects. And the reason for that is because once you deliver, oftentimes your blood sugar normalizes to some degree. But that doesn't necessarily mean that there isn't a weakness. So, with that being said, what is gestational diabetes? It's a form of diabetes that probably about 10% of expectant moms can develop during pregnancy, and the numbers are on the rise. Hormonal changes during pregnancy affect the whole of the endocrine system, and that's an important piece of it. And those changes can cause a weak organ or gland to become out of balance. In the case of gestational diabetes, the weak gland is the pancreas. Normally, the body breaks down sugar and carbohydrates that you eat into special sugar called glucose. Glucose then fuels the cells of the body. A hormone produced in the pancreas takes the glucose from the bloodstream and into the cells so it can be used for energy. Or if not, it's stored as fat. If your pancreas cannot produce enough insulin to keep up with the body's demand, you have too much glucose in the bloodstream, and therefore you develop gestational diabetes. Because this is an endocrine organ, the pancreas is an endocrine organ, there are certain factors that might put you at high risk. So if you're a mom out there in your early pregnancy, or you're thinking about getting pregnant, if you have some of these indicators, this is a good time to get those issues addressed. Number one, if you are overweight prior to pregnancy and have a high body mass index greater than 25, probably a good time to start losing some weight. A diagnosis of gestational diabetes in previous pregnancies. A big warning light right there, as we just talked about. The presence of sugar in the urine or a family history of diabetes is often an indicator. Excessive first trimester weight gain. If this is happening to you and you're at week 12, week 13, and you've gained 20, 40 pounds, this is the check engine light that you need to really have a look at your diet and what you're consuming. A poor diet has also been linked to high occurrence of gestational diabetes, too many carbs, that kind of thing. Or if you have a hormonal dysregulation in your history, such as PCOS, autoimmune thyroid, such as Hashimoto's, etc., there's a possibility that gestational diabetes can be present. It's also possible to have a diagnosis of high glucose without having any of those risk factors or triggers, and that's why nearly all obese test patients between 24 and 28 weeks of pregnancy, they will go through the glucose tolerance test.
Now, with that list that you just gave, a lot of them are like kind of past history, risk factors. Other than the excessive weight gain in the first trimester, are there any other symptoms that a woman might feel that might prompt them to talk to their OB about it sooner than that 24-week mark?
Yeah, I think if they have, if they're, that's a good question.
Are they the same symptoms as like regular diabetes of, excessive thirst and cravings, energy levels?
They would be similar, yes. So definitely there'll be carb cravings. Definitely they'll be going to the bathroom a lot. Oftentimes pregnant moms don't see that as an issue. And yes, they've had excessive thirst. So I would, if I had gained a lot of weight or I was overweight to start with, I would definitely have that conversation with my OB.
Okay, good.
Yeah, because in the first trimester, the baby is so incredibly tiny that someone putting on 20 and 40 pounds in the first trimester is a big check engine light.
Right. And how else does does gestational diabetes specifically affect the baby versus just the mom?
Well, if the mom's sugar levels are too high, the baby's blood sugar levels are also going to be too high. This causes the baby's pancreas to produce more and more insulin. That becomes the problem, is that the baby's pancreas starts to work on the insulin levels, and it causes the baby to gain too much weight in utero. Often moms are having sugar issues, even if they haven't been diagnosed with GB, will often have big babies. If you have a big baby, that can be a problem, especially if you're looking to have a natural birth, for a couple of different reasons. Big babies often have big shoulders, therefore there's an increased risk for dystocia during the birthing process. A big baby also means they're often too large for a lot of moms to fit through the birth canal. And that oftentimes means scheduling an early delivery via C-section. This probably is motivation enough for most moms to want to keep their weight and blood sugar under control, because research has shown us that babies that are born vaginally have much stronger immune systems and have much less problems postpartum. On top of that, babies that are born with a higher than normal birth weight because of gestational diabetes often go on to be overweight kids and then on to adulthood. So we're passing on some epigenetics that will get expressed later if this is not handled well. So it's really important. And if you're looking to have a natural birth, it is critical that you have a baby that's, 8 pounds or less, and that you have the option to have this nice, wonderful, juicy birth.
And so I guess the screening test is the first thing a woman should be looking at and asking or talking with their OB about. What is that glucose challenge screening test?
The screening test is a really simple test. I think 99% of the OBs will request it. There's no preparation required. They'll ask you to drink a sweet glass of liquid glucose and then have their blood drawn an hour after the drink. It'll be a fasting test. And what they'll do is blood glucose normally peaks, and it will provide a reading to see how well the body is handling sugar. A high level in the blood may indicate that your body's not processing the sugar effectively, and if this test is positive, it's important to know that not all women that test positive for this challenge test are found to have gestational diabetes down the road. The ingredients in the drink, it's pure glucose, so it's not exactly fabulous. It's got a lot of artificial flavors in, but it shows you that you have some opportunities. So what should you do if that's what happens to you? And it happens to moms that are, not necessarily overweight. They could be following a paleo diet or a low-carb diet, and therefore a sugary drink like that can really cause a spike in blood sugar level. But here's what it does. It gives us a clue, and this is the key concept in this whole talk today. This gives you the opportunity to understand that maybe you're not doing such a great job of managing your blood sugar on a day-to-day basis. Moms are often hypoglycemic, have low blood sugar, or if you're following a vegetarian or a vegan diet, you've probably got too many carbs and not enough protein and veggies. There are also mamas out there that have hormonal issues in the past or are currently under a lot of stress during the test. So if this comes back, if you're not handling the blood sugar or positive in this regard, it's a good time to think about what triggers blood glucose for you. It's a check engine light. It says we need to make some changes. So let's have a look. It could be often some benign foods that are causing a blood sugar spike in some people. So the first thing you should do is if you're eating sugar, you need to stop. Second, you need to increase your intake of whole foods and particularly veggies and make sure you're getting adequate amounts of protein and good fat. Secondly, get yourself a blood glucose monitor and some good blood glucose strips. You can get that easily on Amazon.com. It's very expensive. The monitor and the strips comes with instructions, and it's really easy to have a little finger prick, and you test your blood several times a day to see what those results are. And it gives you some really good clues. Fasting levels for a good reading should be about 86, and you take that first thing in the morning. An hour after eating your food, you test it again, and your blood glucose reading should be around 140. 2 hours, 125, 3 hours, back to fasting level. So these levels are functional levels. I need to tell you that. The American Diabetic Association has slightly higher levels than that, and there's some variation on all of these. The third thing you do, in conjunction with taking your blood, and at least do it for a week or two, is you should have a food diary. What you need to do then is record your food at the same time as you're recording your blood glucose levels. And oftentimes you'll find that certain foods cause higher spikes for you personally. Sometimes in some moms it could be chicken, something that you wouldn't even imagine, or salmon, or tomatoes. Or you could find after a really stressful day at the office, or sleep is impacted in some way, that your blood sugar levels could be off. So it gives us some information, and certainly the mom gets some information, and anyone that you're working with. Once you have that information, modify your diet a little bit, and so that you make sure that you stay in those ranges, and you'll find that you'll probably notice that exercise has an impact in a positive way. So you have information, which is really good information. And if you take that information, saying you failed the glucose screening test, and you take that information to your OB along with the food diary, chances are, if your numbers are good, they'll waive further testing. If not, then of course you're going to be taking the glucose tolerance test.
And how long would you expect is long enough but not too long to be able to make those dietary and exercise changes for some results to show up? Is that like days, weeks?
Yeah, I think that normally what would happen is that the glucose tolerance test would be scheduled 2-3 weeks after that, or even 4 weeks in some cases. So what I would do is I would take that 2 weeks to give yourself a window.
Okay.
And I would up my exercise if I'm not. I would cut out my sugars. I would certainly look at increasing protein and good veggies. I would reduce my stress levels. I would try to see where that is happening for me. And certain foods, like I could have a mom who could eat a whole wheat bun and it wouldn't be a problem, but if she had a cup of rice, it would spike for her. So looking at the foods that trigger blood sugar, then taking those out, because they're going to learn a lot of information that's not only good for them now while they're pregnant, but that's not going to change down the road. Those foods should probably always be modified in their diet. So it's really kind of well, this is not a good thing. This is happening to me. I failed my screening test. But on the same token, if I take, some accountability around that and do some further testing, and if I'm unsure, go to a nutritionist or an endocrinologist to help, or talk to my OB about it, then, I have information down the road that's really good for me and the rest of my life. You monitor your lifestyle. It's really good information.
Right. And that's what you were saying at the beginning, where it's kind of a gift in disguise.
Yeah, exactly.
Yeah. So what if they do take the glucose tolerance test and then that result is abnormal? Where do you go from there?
The glucose tolerance test is a comprehensive test, and if it's abnormal, more than likely your doctor will certainly send you to an endocrinologist at this point. There's, abnormal might be that there's more than one of those readings out of the ones we talked about, fasting, 1 hour, 2 hours, 3 hours. Don't get a diagnosis. Most of people will want to deal with it right there and then. There's a couple things you can do. If you haven't already started monitoring your blood sugars we talked about earlier and made a food diary, they'll definitely want you to do that. The second thing is that this is a red flag. And if you have these problems and you haven't been doing any exercise, you haven't taken the first step that we talked about, you need to then go and address those in a really vigorous way. So now is the time to really make those changes if you had ignored them earlier.
And this is all typically done at the end of the second trimester, so you're looking ahead at all these changes to really impact the third trimester.
Under control.
Okay.
Yeah, because what most people want is they don't want to have a big baby, they don't want to have complications at birth, and a lot of people don't want to have a C-section either, and they don't want to put their baby or themselves at risk. So they need to make those adjustments. And, you know, if this happens, there's possibility of some medication also. So there's a good chance that with diet and supplementation and regular exercise, the doctor might want to put you on some medication to bring those glucose levels into line.
Okay. I'm sure this is kind of a generalization, but how often would you say that the dietary modifications as well as the exercise could prevent the medication? I mean, is it near 100% or very high?
It's a challenge, to be honest with you, Jay. If a mom fails the test, the screening test, then we have a good possibility of being able to, because we have some time.
Yeah.
If they fail a screening test, it's much more difficult, and to do that without medication, to start there. The key is if moms have some of the indicators that we talked about early on, and they should definitely be making those changes in the first trimester.
Okay. Right.
So that they can avoid gestational diabetes down the road.
Right. So avoid all of these
have
problems.
All those problems. Yeah. So if you are diagnosed with gestational diabetes and your doctor does want to put you on medication and you have tried really hard to do all these things, moms often feel a little bit depleted, a little deflated, a little discouraged. The biggest number one goal for moms who have had that opportunity, who have done everything, they've tried everything, and it hasn't happened for them, their number one thing is to continue to eat well and exercise, and above all, keep their stress levels and enjoy their to a minimum and enjoy the rest of their pregnancy.
Mm-hmm.
Worrying and hand-wringing will only impact it. Stress has been known that under high cortisol, stress has been known to impact blood sugar. So this is critical at this point. What's key then is the future.
Yeah. So what does the future look like after baby's here, and kind of putting the birth issues aside with the big babies, like for mom and then also potentially for the baby?
That's true. It's a key concept. Oftentimes when you give birth, your doctor will sometimes say, well, you no longer have gestational diabetes, because it's different. But it does often go away with the birth of the baby. However, you still need to be aware, and most moms tell me this. My doctor didn't tell me that I was still at risk for type 2 diabetes down the road. And we're not talking a couple of years. We're talking 5, 10, 15 years down the road if I didn't make changes, or I just went back to my normal eating habits, my gestational diabetes went away. You are at high risk because you already know that your body's not handling insulin and glucose well. So I think that's something to understand, is just because the gestational diabetes went away with birth, it doesn't mean you could ignore all these good things that you should be doing because you're at high risk down the road for type 2 diabetes. So moms are usually very motivated during pregnancy, and outcomes are obviously pretty good. The key is to stay on track after baby is born. It's critical. They're more likely to have gestational diabetes in their second pregnancy as well. After baby is born, 5 to 10% of mothers who've had gestational diabetes will have type 2, and that's the key that we were talking about. So they really need to understand that that's a really big factor. So being overweight or overweight or obese is the leading risk factor to developing type 2 diabetes. Even losing 5 to 10% of your body weight postpartum is a good goal, especially if you went into your pregnancy with a little bit of extra poundage. Breastfeeding the baby is also good to help you bring all the levels down, and it also is great for baby eating a healthy diet and continuing to do that. I can't stress enough that if you have struggled with endocrine issues, overweight in the beginning of your pregnancy, struggle with blood glucose and insulin, that you really get on board now, not only for you, but for your baby. It's a really big thing. So I'm going to leave it with that, but I really want moms to understand that this is an indicator that something is a little bit awry in the endocrine system, and that it's, yes, it can go away once baby is delivered, but it's still, that check engine light that we need to think about. And we also want to make sure that epigenetics is so important. We've talked about this before, that we pass on the best genes to our kids so that they have the best opportunity at a healthy life down the road.
Right, because even if there is a challenge during the pregnancy and epigenetically the child is maybe predisposed to, some diabetes challenges later on down the line, if you make those dietary changes and the lifestyle changes and the exercise changes for yourself, your kids are going to learn those habits from you throughout their childhood, and they're more likely to eat well and to move well and to, handle their stress levels well. So even if that epigenetic switch has been maybe slightly turned on because of the gestational diabetes, making those changes afterwards will help your child not be as at risk.
True, absolutely true. And that's really what we're saying with this.
Yeah. Now, and I would imagine too, kind of going back to the beginning of the conversation, that, one is for a woman to, recognize that this is a significant issue and that something needs to be done to move forward, but also to move forward in the right directions, right? Because I would imagine there's Google is full of all kinds of different information. What can you say about that in the last minutes that we have, about where to get some information? Obviously from you, what resources you have, and maybe some others.
Well, certainly I'm happy to, if anybody is interested out there, to have a hard copy of our podcast today, so they have time to really sort of sit through and look at it. I'd be happy to forward that on to anybody that wants to email me at drpiamartin@gmail.com. So it's drpiamartin@gmail.com. There's some good information out there. Oftentimes, though, it's a little bit confusing. Some of the blogs out there are a little bit, how shall I say, emotional, and that's good for emotional support, but maybe not always full of practical. And for me, what I would want to know is, okay, if I have been having these challenges, or I had a history of these challenges, what do I need to do? What's concise? What are the steps? And so the steps is like, get a glucose test kit and a food diary and start looking at what you can do. Exercise is good. Carb cutting is good. Monitoring blood sugar is a good idea. Keeping a food diary. All of it, keeping stress levels low, all good things that one should do. So definitely, if you're in a high-risk area, definitely should be doing that either preconception or early on in pregnancy.
Okay. And I'll put all those, the links that she talked about with the email address, and then also links to Dr. Pia's website in the show notes of the podcast, but then also on the blog post that we put up, it'll have links so you can get in touch with her directly. And then also probably will you have information there about how to get your upcoming book? I know it's not out and available yet, but they'd be able to find out information about it there.
Well, you're putting me a little bit on the spot.
I am on purpose, Dr. Pia. You need more of your information. I am putting you on the spot. Good for you to notice that.
Yeah, putting on the spot. My hope, Jay, is that we get it out in the first part of 2016. And I know there's a lot of moms have been asking me, when's your book going to be out? When can we have it? This is one way where we get little bits of information out there to you. But my goal is to get it out there early part of 2016.
Excellent.
And the other thing too, if they go to drpia.com, there's lots of really cool blog posts that they can look through that will give them some information on different subjects related to pregnancy. I recently did one on a healthy gut, a healthy baby. So that's an important one too for some moms. Making sure that their digestion is working well. Maybe we can talk about that in the next podcast.
Okay, that'd be a great idea.
Yeah.
Yeah, I mean, I know you run a very busy practice. You see a lot of patients, and for you to be able to, take time out of your schedule to share this information with us is amazing, and I thank you. And that you're even compiling all this information into a book resource for people that are, either your patients or, that aren't able to come to you in San Diego, that you'll be able to share your wealth of information. So I thank you for all of that.
Thank you.
Yeah. So with the last minute that we have here, what is the great take-home message that you want for moms to either hear and take to heart or take action on?
Well, I want them to understand that, and this is kind of the core for me, is that if you're going to, you're thinking about having a family or you're early on in your pregnancy, is the key concept, the core is that you're building a human. And I want that human to have the best life as I know they do. And so it really is important thing to think about, that what moms are eating, drinking, thinking is going to be a part of this human that they're building inside of them. And so I want moms to make informed choices. I want moms to be mindful about their environment, and I want them to get a team of people that can help them, support them throughout their pregnancy, and to have their kids have the best opportunity.
Excellent. Well, thank you for that. And, I'm going to put your information where it's accessible for people listening so they can get in touch with you to have you be possibly on their team to help you through. So thank you again, Dr. Pia, for being here. For those of you listening, the episode that she did on prenatal nutrition is indeed 005. So look for that in the rest of the podcast episodes. And Pia, I just enjoy talking with you every single time, and we hope to have you back real soon for more information.
Thanks, Jay.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the Cap Wellness Center look forward to helping you and your family be as happy and healthy as you can be.